Thank you for joining us. My name is Susan McVeigh. I'm the health officer for the city of Hackensack. I'm here with our representatives from HARP, that's the Hackensack Awareness Regional Program. They're our health educators from Hackensack Medical Center. We're here to talk about the novel coronavirus updates and what you should know. So welcome and please listen. At the end, if you have any questions, feel free to call the health department at any time. We'll do our best to answer them. Thank you.
Hi everyone, my name is Shireen Bakhtiar and I'm a health educator at Hackensack University Medical Center. I'm here to share some information with you that you should know about the current outbreak of coronavirus. So, the current coronavirus is a common family of viruses, just like the influenza family is a family of viruses. They both circulate seasonally every year, but the coronavirus is known to cause respiratory illnesses, and it also spreads much like the cold and flu. COVID-19, which was the proper term given to the novel coronavirus, can be unpredictable. And so because of its unpredictability, there is no immunity. However, it is watched closely by the CDC, and the CDC is gathering information on how this virus behaves in human populations. Other recent coronaviruses that you might have heard of are SARS, which was the severe acute respiratory syndrome identified in 2003, and more recently MERS, the Middle East respiratory syndrome, which was identified in 2012. Am I at risk is a common question that public health call centers have been receiving. This is a rapidly evolving situation, and some people have risk, but that varies among populations. And so at this time, the risk is spreading in some communities faster than others in the US. The CDC has implemented enhanced health screenings, and the US Customs and Border Protection are all helping to detect new cases and prevent further spread of COVID-19. They are also using measures like isolation and quarantine. Isolation separates sick people with a contagious disease from people who are not sick. Quarantining separates and restricts the movement of people who are exposed to a contagious disease to see if they eventually become sick. People who have been determined to have at least some risk for being infected with the virus that causes COVID-19 may be actively monitored or may undergo passive monitoring. Active monitoring means that the state and local public health authority assumes responsibility for establishing regular communication with potentially exposed people to assess for the presence of symptoms like fever, cough, or difficulty breathing. Passive monitoring means people monitor themselves. Anyone on self-monitoring should be provided a plan for whom to contact if they develop symptoms like fever, cough, or difficulty breathing during the self-monitoring period. And so, in an effort to put your risk into perspective, we know that the flu causes millions of cases of illness each year in the US. In 2017 to 2018, there were about 45 million cases of flu, of which 12,000 to 61,000, my apologies, were deaths. Flu severity is unpredictable, and healthy people can become seriously ill from the flu. In general, flu causes low level of concern because it is something that we are familiar with. Coronavirus, however, is more unfamiliar. And so to help you become familiar with it, we're going to talk about a few signs and symptoms that you should be aware of. Coronavirus can cause respiratory illnesses. This can include some fever, cough, and shortness of breath. These symptoms range from mild to severe. And of the people who have severe illnesses and have died, most of them were older adults or those with vulnerable health conditions. There is no specific treatment for coronavirus or COVID-19 as of yet. However, symptoms can be treated with decongestants, cough suppressants, and fever-reducing medications. There is availability of treatment in hospital settings for severe cases, which can include pneumonia, and difficulty breathing. Coronaviruses spread much like other respiratory illnesses. They can spread through air by coughs and sneezes. They can also spread by touching an object or surface with the virus on it, then touching a person's eyes, nose, or mouth. Having close contact with those who are sick can increase your risk of infection, and healthcare workers need to wear protective gear to prevent exposure and spread during medical care and testing procedures. The incubation for coronavirus is defined as the time from when a person is exposed to when they develop symptoms. For COVID-19, the incubation period is about 2 to 14 days. There are some reports that the disease may spread before a person has symptoms, but this is not the main way the virus spreads. People are most contagious when they are most symptomatic. And so again, according to the CDC, outbreaks are not driven by pre-symptomatic spread. As with any new virus, there is still much that the CDC does not know. They are analyzing data as it becomes available to learn more so that they can give us the most accurate recommendations and guidelines. Information is being shared with states as it becomes available. We can prevent the spread of coronavirus by covering our coughs and sneezes with tissue or our sleeves, not hands. If using a tissue, be sure to throw it away and do not reuse it. If using your sleeve to cough and sneeze into, be sure to completely cover your mouth and nose with the fabric and sneeze. Washing hands often or using hand sanitizer when soap and water are not available is another excellent way to prevent the spread. Be sure to scrub your hands for at least 20 seconds with soap before you rinse them off with water. Stay home when sick and avoid others who are sick. Another common question that we've been asked is, should I wear a mask? The CDC does not recommend the routine use of face masks by the general public. There are different types of masks. One type of mask is the N95 respirator. This mask protects the person wearing it. Fit testing is required to ensure proper protection for this mask. Another mask we often see is the surgical mask. This mask does not effectively filter out small particles from the air. Loose-fitting face masks such as this one are usually placed on a sick person when they are coughing and sneezing to prevent them from contaminating the surrounding area and surrounding people. Patients with confirmed or suspected COVID-19 should wear a surgical mask until they are isolated in a hospital or home. If you are planning to travel to an affected area, follow the CDC guidelines. The CDC has posted strict travel restrictions and recommendations on their website. They encourage you to avoid non-essential travel to areas specified by them. Check this website frequently. If you must travel, please avoid contact with sick people, avoid animals, alive or dead, animal markets, uncooked meat, and as always, be sure to wash your hands frequently. If you have recently traveled to an affected area and feel sick, seek medical care right away. Call before going to the provider's office, urgent care, or hospital. By giving these providers a heads up about your symptoms and travel history, they can prepare for your arrival and make arrangements to prevent any possible infection from spreading to others in the waiting area or even our healthcare workers. Avoid contact with others and stay home. If you live with others in the same home, try to stay in your private room, suite, or bedroom. This is another good time to use grocery and medicine delivery systems. Please cover your coughs and sneezes and remember to wash hands often or use hand sanitizer when a sink and soap are not available. The CDC is working with the World Health Organization to closely monitor this outbreak. They're also working with state and local public health partners, enhance entry screening at designated U.S. airports for passengers from high-risk countries, and monitoring travelers with symptoms compatible with COVID-19 infection and travel history from high-risk countries are all initiatives that the CDC is moving forward with to rapidly find and contain the cases in our communities. The CDC is providing educational materials to screen passengers with instructions on what to do if they become ill within 14 days after arriving back to the U.S. from a high-risk country. On this slide is a photo of some of the information they receive. Those who should be tested must meet specific criteria, like recent travel to an affected area and respiratory illness symptoms. Healthcare workers or other people who have had contact with a lab-confirmed case and symptoms should also be checked. People with no known exposure but with severe lower respiratory illness requiring hospitalization and without another explanatory diagnosis such as influenza should be tested. There is no general screening or swabbing for people in the U.S. who feel ill and have no history of travel. The New Jersey Department of Health is working with state and federal partner agencies to establish plans and procedures in the event ill travelers are identified. New Jersey Department of Health staff are creating guidance documents to help public health professionals and healthcare providers in investigating and managing cases as well as people they have had close contact with to try and minimize the spread of the virus. Please remember, there is a lot of misinformation out there, and even the news media gets the facts wrong sometimes or try to sensationalize the information. And the comments that people leave on news websites or comments on social media posts are often incorrect. Please visit credible sources of information such as those listed on this screen. Social media and the internet make it too easy for people to spread false information. For anyone with an urgent concern, please call the COVID call center at 1-800-222-1222. They're available 24 hours a day, 7 days a week, and are able to assist you in multiple languages. For any further questions, you can reach out to your local health department, and they will do their best to guide you and inform you on the changing health conditions. Or you can check hackensack.org for updated info.
So thank you everyone for joining us. I'm very sorry that we couldn't have people here in person, but for the utmost safety and health of our residents here in Hackensack, we thought it would be more appropriate to have it videoed so you can view it online. If you have any questions, as I said before, please call the health department, 201-646-3967. I'd be happy for either myself or one of my staff to answer your questions. And I also have links online at hackensack.org to the number that Shay mentioned, and also a link to New Jersey Health Department. So you can get all the updated information. As you know, things are changing every day. My latest update was 5 cases. I believe I heard this morning there are 15 cases in New Jersey. These things are changing because this is a new virus every day. Make sure that you get your information from good resources that are respectable, that you know that you can trust. That's the CDC, the Center for Disease Control and Prevention, the New Jersey Department of Health, and of course the City of Hackensack Health Department. We are always here for you. If you have any questions, we are here and we are happy to answer them. Thank you so much again.